So the vaccination is going in Africa, but unfortunately the pace is slow, and you'll find that really few countries have managed to reach the target that was set for September, and most likely they will reach the target that is set for December. December target is to get at least 40% of African population vaccinated, and the September target was 10%. And if you look at at the September target, only 15 countries on the continent have managed to reach that target. So I think many countries are trying to really vaccinate, but the problem is actually availability of these doses.
So you're saying it's the availability, not necessarily the organisational capacity within many of those countries?
At the moment, is definitely availability of the doses. I think most African countries are relying very much on the COVAX to supply the vaccines. And we know that, COVAX is also trying its best, but it can't meet the demand of the African countries. So it looks like the countries which have been able to reach the good vaccination coverage were able to source these vaccines from multiple suppliers.
Is there any hesitancy from people across the continent to have the vaccine?
That is a problem, but it's definitely a secondary problem. I know that there are some countries like South Africa where availability of the vaccine is not necessarily an issue. The issue is to get people vaccinated. So anti-vaxxers and vaccine hesitancy seems to be a problem in some countries, especially South Africa, because certainly South Africa does have a reasonable amount of vaccines at this stage.
And so what is the government doing? And you sit on that advisory panel. What is the discussion around trying to communicate and improve that take-up?
So there are a number of initiatives at the country level. 2 weeks ago, the president of the country initiated a campaign. They call it VUMA, COVID-19 vaccination campaign, to try and motivate people to get the vaccine. However, it hasn't done much difference. And last week, Tuesday, they launched the vaccination certificate. And hopefully, with the vaccination certificate, it will somehow motivate people to get the vaccine. Because if you do have a certificate, you might be allowed access to certain establishments.
Yeah. There is a lot of discussion that if the vaccination rates don't improve across continents like the African continent, this could cause problems with the mutation of the virus, as we've seen with the Delta variant, that become far more deadly. Is this a discussion that has been had?
I think most people are aware of that, if the vaccination coverage is very low, as is at the moment, this will really increase the risk of COVID-19 vaccine strains, mutations, new strains emerging, and I think is very much a debate for scientists rather than the public, because for the public, they can't care much about whether mutants will emerge because of very slow vaccination coverage. It's very much a scientific debate.
That is fascinating. And therein lies the problem, because there is this perception that Africa has not been as badly hit as other nations. Is that correct? Or is there just not the testing regimes? Are people potentially dying from the virus and the data's not being collected?
My take is that we just don't understand the extent of the COVID-19 problem in Africa, because some countries are doing well with the testing and reporting, but other countries are not. Even though the testing tools that become more and more increasingly available. Some countries are not really testing at a rate in which it is expected. So I think it's really about perception. The fact that maybe Africa is not as affected as other, continents.
I think South Africa, initially the president put the country under a hard lockdown, but he soon realised that that wasn't going to be feasible, given that if people weren't getting out and working, they probably weren't going to eat, and therefore there was going to be deaths in other forms. So lockdowns haven't necessarily played a big part. Do you think that's been an issue in terms of not letting people realise the extent of the problem?
Well, initially the lockdowns were part of the solution because people, I think, for a start, the lockdowns raised a certain level of awareness about the disease and the virus, of course. But as time went on, obviously, some people just started to relax the measures, especially the non-pharmaceutical interventions. And as we speak, I think increasing the lockdowns to the highest level is very much about protecting the healthcare system rather than increasing awareness. So people are aware of the disease. It's just that they are not doing their part to assist the government to contain the disease.
Yeah. So do you think countries like Australia, the US, the UK, Europe, should do lots more in terms of providing and donating vaccines to the continent?
Of course, I think every vaccine will be highly appreciated because there are a number of countries which have not even vaccinated, more than 2% of its population. So I guess that some countries would really benefit from the vaccines, regardless of where these vaccines come from.
Yeah, Professor, great to talk to you. Thanks for joining us.
My pleasure.